Yes. Today I'll be presenting on factors which are associated with arterial stiffness, post-tuberculosis treatment in adults with pulmonary TB. This slide, you guys have seen this the whole 2 days. There are an estimated 155 million TB survivors worldwide. Those with history of prior TB have nearly 3 times the risk of death compared to the general population. That's huge. And although TB most often affects the lungs, cardiovascular disease was actually the largest contributor of post-TB mortality in a recent meta-analysis. There is about a 50% increased risk of cardiac events amongst those with prior TB, which is equivalent to having smoked about 10 cigarettes a day for over 25 years. Inflammation may link TB and cardiovascular disease. The graphic on your right there, my left, shows how we are thinking about this. We know there are traditional risk factors for cardiovascular disease related to genetics, aging, comorbidities such as diabetes, hyperlipidemia. There's also evidence that infections can increase the risk of cardiovascular disease. That is likely all mediated through increased inflammation. And together, these traditional risk factors and infections can result in subclinical vascular dysfunction. Since most cardiovascular events occur years after TB treatment, it raises the possibility that TB does actually promote subclinical vascular dysfunction, predisposing survivors to future cardiovascular disease. If true, it may be possible to identify high-risk patients during or soon after TB treatment to intervene before such events occur. However, a lack of prospective data informing a mechanistic understanding of this risk is a major knowledge gap. Our aim was to determine if greater TB severity, measured by high-resolution CT, is associated with pulse wave velocity, which is a measure of arterial stiffness after TB treatment completion. So, where I'm from, we conducted a secondary analysis of a prospective cohort study at the Aurum Institute in Tembisa, here in South Africa. The cohort included participants who are adults with newly diagnosed revampant susceptible pulmonary TB with and without HIV co-infection. High-resolution CT imaging was performed at baseline and semi-quantitatively scored by a clinical radiologist to reflect the percentage of lung involvement. And also a carotid femoral pulse wave was measured using a sphygmocore Excel system at 6 months and 12 months after enrollment, which aligns with treatment completion and then 6 months after treatment completion. And this pulse wave velocity is a measure of how quickly the pulse is transmitted from the carotid to the femoral artery. Therefore, higher pulse wave velocities where moving faster would reflect more stiff arteries, whereas a lower pulse wave velocity would reflect more elastic, flexible arteries. And higher pulse wave velocity is associated with future cardiovascular disease. On the table there, you'll see characteristics of our cohort. The columns are organized by HRCT involvement, and the rows are participant characteristics. Of 72 participants, over half of the cohort had moderately severe or severe HRCT involvement. The median age was 35 overall. This is a very young cohort representative of the local working community population, 76% were male, and participants with very severe HRCT involvement tended to be males in our cohort. The median BMI was 19.4, and about 2/3 reported smoking and half reported alcohol use. You'll notice there that none of the participants seemed to have high blood pressure, with a median systolic of 117 and a median diastolic of 74, and a mean arterial pressure of 89. Of the cohort, 6 months pulse wave velocity measurements were done on 72 participants, and 12 months pulse wave velocity measurements were done on 28 participants. And you can see there is a trend towards higher pulse wave velocities with increasing TB severities, as evidenced by mild having 6.2 all the way up to 7.7 at 6 months in the severe group, and all the way up to 9.3 in the severe group at 12-month time point. Okay, so these are our results. As you can see in the unadjusted models, the extent of radiographic involvement on HRCT was not associated with pulse wave velocity. Age, however, was associated with a 0.1 meters per second increase in pulse wave velocity, which is expected because of people's age. When people age, arterial stiffening is a known phenomenon. And after adjusting for age, sex, and smoking status, with the current numbers we have, it does not appear that radiographic severity is associated with increased pulse wave velocity. Age and male sex were associated with increased pulse wave velocity post-TB treatment completion. In the preliminary analysis with a subset of our cohort, baseline HRCT score does not appear to be associated with increased pulse wave velocity after TB treatment, but we found that age and male sex are associated with higher pulse wave velocity following completion of treatment. This indicates that vascular aging and sex-specific factors could play a role in influencing arterial stiffness after TB. And looking ahead, future analysis should include a larger sample size and adjustment for blood pressure to better understand this relationship. And further research, including longitudinal studies and repeated measures, will be important to fully understand the cardiovascular consequences of TB. And more detailed analysis of those HRCT features and TB severity are currently ongoing. And I thank you for your attention.